Welcome to Health Professional Radio. I'm your host, Neal Howard. Well, summer is just around the corner, bringing opportunities to travel for both business and pleasure. But hitting the road might bring on some aches and pains, especially if you suffer with rheumatoid arthritis. Here to talk about some ways to manage your travel triggers if you're a sufferer of RA are Dr. Grace Wright and Maria, a patient dealing with RA. Welcome to the program, both Dr. Wright and Maria. Thank you both for joining us today.
Thank you.
Thank you.
Right. Dr. Wright, what is RA, rheumatoid arthritis, and how many of us are affected by it?
So rheumatoid arthritis, or RA as we refer to it, is a chronic inflammatory, often disabling arthritis that can affect both young and old, male and female. We have 1.3 million Americans living with RA, and about 2/3 to 3/4 of those are women. So we have the 4-year-old children, but the majority are somewhere between 20 and 50 years of age. So really impacting everyone. What you experience is fatigue, swelling, and stiffness through multiple joints. It really does impact everything that you do.
And would you say it's the most common form of arthritis?
Well, osteoarthritis is probably more common than rheumatoid arthritis, but it is the most common inflammatory arthritis, to distinguish the two types.
So I guess dealing or affecting everything that you do, travel would be a biggie. I mean, just traveling from one room to the other can be a demand, let alone traveling from one location to another. Maria, you've been dealing with RA how long now?
34 years.
Mm-hmm. And during those 34 years, you've not been stationary. You've been traveling, to various places. How do you manage your condition when you're traveling from one place to another, especially places that may not be familiar to you?
I love to travel and I refuse to stay at home. I am retired now. I used to be in business and I have to deal with the RA, but I did it anyway. Now I'm retired and I'm traveling more for pleasure. It's challenging.
Mm-hmm.
It's challenging. I have physical limitations. I'm no longer travel by myself. A member of my family always travel with me, so can assist me with my luggage. But I always take my scooter. I have a scooter that I take with me, and I move through the airport with no problem. It gives me a lot of freedom. I can check it at the gate and get it at the gate where when I arrive to my destination. Also, another challenge is I get a lot of discomfort on my feet while traveling. So after takeoff, if I'm traveling by plane, I get up and walk. That helps. That relieves the discomfort on my feet. And I also carry some lotion with me so I can massage my feet. That helps too. If I travel by car, stop every 2 hours and get out of the car and walk a little bit so I can relieve the stiffness and the swelling and discomfort.
So it sounds like there's a lot of environmental factors that you are dealing with that you have to overcome. In addition to, I'm supposing, some of the medications that you may or may not have to take. Dr. Wright, what types of treatments, medication-wise, are available for folks suffering with RA such as Maria?
Well, fortunately, we have many treatment options available today that can be used singly or in combination. So I'm here today speaking on behalf of Sanofi Regeneron, but you know that we have tablets and capsules that can be taken by mouth. We also have agents called biologics that can be given as injections, so patients can inject themselves at home and keep their medications at home. There are other injections given in the office, and there are also intravenous infusions that can be given in the doctor's office or the hospital that really target the disease, target the various inflammatory chemicals within the body that are driving this disease to try and get this into remission or to the lowest level of disease activity possible, so that patients can enter back into their lives and do things like travel or work or take care of family, but really sort of come out of this state of swelling and stiffness that can occur with this chronic disease.
You know, listening to Maria talk about encountering the airport with a scooter and things of that nature, and even talking about after takeoff, managing some of her pain in those ways. From a medical standpoint, traveling by air, is it greatly different, being pressurized and whatnot, as opposed to traveling on the ground or even on a cruise?
Well, things that you have to think about with air travel is, we forget to drink. We don't get quite the same amount of hydration that we need, and it's very important to stay well hydrated. The other issue is that you're stuck in this small seat, and for patients who have problems with their neck, because RA can affect the neck, or it affects the hips and the knees and the feet, you end up sort of cramped and stiff, and that alone can cause a significant amount of discomfort. On a cruise or in a car or a train, you have a little bit more room and you're able to flex those muscles and move about. So on a plane, it's important to really move, whether it means sort of squirming in your seat, exercising in your seat, or getting up and taking a walk down the aisle as you, hydrate. That is really crucial for air travel.
Maria, in 35 years of traveling and dealing with RA, would you say that your environment and dealing with your environment is more of a relief or management strategy than medications, biologic or otherwise? Or would you say it's kind of a 50-50?
It's a combination. Mm-hmm. When I was diagnosed with RA, there were no treatments that work that great, that good. But now there is several different treatments, and it's better. Mm-hmm. And in traveling, the easiest for me is by a cruise. Taking a cruise is very easier for me than flying or driving. Okay. But through the years, I learned how to deal with this and to enjoy traveling.
Great. Well, Dr. Wright, where can our listeners go and get some more information online about RA and managing some of the pain, especially during travel?
So there are many useful websites. The one I'm going to direct you to is yourramoments.com, where you can find useful insights and tips for living with and traveling with RA.
Great. I thank you both for joining us here on Health Professional Radio today. Dr. Grace Wright and Maria, it's been a pleasure.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at healthprofessionalradio.com.au and also at hpr.fm.